This is Whitney Bell and welcome to my YouTube channel. I posted probably about a month ago with a review on the Free Me Independence breast pump, and from that actual post I saw that several ladies on the post were asking for breastfeeding tips. So that's what this video is about today. So I'm going to give you some of the tips that I kind of had to learn on my own, and I also had to research in order to be able to successfully breastfeed with a larger breast. So just a little bit about my journey. So I'm a 36K, and so my breasts are a lot larger than, women who fill traditionally an A to D cup. So for women like us, it's a lot harder to just follow those techniques, the textbook techniques, just because you have to do a little bit more maneuvering and a little bit more adjusting for the baby. And so today I'm going to kind of give you some tips on how to successfully breastfeed your child. So a couple of the different techniques I want to go over. Number one, when I was in the hospital, I learned about the football hold. I learned also about the side hold. And then I also learned about the natural hold, which is lying on your back. Now I'm going to kind of review each one of those. And so with the actual football hold, where you have the baby on his back, or him or her on his back, and you actually have to lift your breast to put it in the baby's mouth. That one wasn't so successful for me, and it's just because my breasts are a little bit larger, so I wasn't able to successfully feed him because my breasts were smothering him. So I had to kind of adjust and find another technique that actually worked for me. And that brings me to the natural position. And so with that one, you actually lie on your back, and apparently they said the baby can crawl up your stomach and find your breast and latch naturally. Tried that, except when the baby latched, he actually pinched my nipple area, and so that actually did not work for me at all. I was not we weren't able to kind of find a groove with that. And so for me, that didn't work. Now, the one that did work, and I had to make a few adjustments because I know with the cross cradle hold, you do have where traditionally a woman that has, from an A to D cup, she's able to just kind of put the baby up, and the baby just magically starts sucking and figures out all these wonderful techniques that they talk about. With women that are anywhere from, I would say, F to a K cup, and that's UK sizes, so it would be to size O, I guess, for US. That's not really that feasible. So for me, we're going to talk a little bit about breast positioning. For me, my breasts sit a little bit lower, and so the nipple kind of hangs this kind of like this. And so my nipples aren't perfectly centered like some women have theirs right here. Mine kind of go outward this way. And so if you have breasts that are that size or that have that kind of shape, it's a little bit difficult to just think that you're going to bring the baby up and just smack him onto your breast and he's going to magically latch himself. That's just not realistic. You're going to have to do a little bit of work. And today I'm going to kind of show you exactly how to basically successfully feed your baby using the cross cradle way. That is the number one recommended on my part. That's the number one recommended position, just because any other position is going to cause either pain or strain on your back, or it's going to be uncomfortable for the baby. The baby may not be able to breathe. So with this position, I recommend a couple of things. Just a regular bed pillow. So just like a regular standard size pillow. If you want to get the jumbo one, that's fine. Number one, for your back. So if you're sitting in a chair like this, or a bench, I'm sitting in a bench, or a chair that has handles on it, I recommend a chair that has armrest. That's a good chair that you can sit in. But you're gonna need something to support your back so you can lay back. You're also gonna need a second pillow to actually lay the baby across. Now some of you, for me, the boppy didn't work. No offense, it didn't work for me. A regular pillow worked just fine. If you need to elevate the pillow a little more, maybe if the pillow is sagging, I would suggest getting another little small pillow, maybe to prop it underneath to give you some stability. And that's pretty much all you're gonna need. And so for this position, you wanna sit up straight like so. And I wanna make sure you have, right now I don't have a pillow behind me because I'm pretty, I got some good support back here. So I don't have a pillow behind me, but just for those who need that extra support, absolutely get yourself a pillow, prop it up behind you. And then this pillow itself, you kind of have it centered here, and you want to make sure that it's level enough where if your nipple was centered, the baby is able to successfully just latch on that part, if that makes sense. Hopefully that makes sense. So next thing you're going to do is, if you have, like I said, a nipple that kind of droops down a little bit like mine, what you want to do is take your breast like so, and you want to kind of lift up like this. So you want to make your nipple center as if it was center with gravity, essentially. So you do have to like kind of adjust your breast a little bit here. Now, sometimes what I do is, if I'm in a situation where I have a chair that, you know, has armrest on it, I'll take another pillow and just put it like right in between the armrest to kind of give me some cushion like this. So that way you're not straining. So that's going to give you a lot more cushion to have something to prop your arm up on. So again, if you're holding your breast like so, you're just going to take it and gently lift it up. Make sure the areola is kind of raised, so like center like this, and then your nipple should point outward like so. Okay, so hopefully that makes sense. So we're going to pretend we got Buddy here, little Buddy. My son's little toy that he has yet to use. So we're gonna pretend like Buddy is a baby. And so with Buddy, I found that I know some of the techniques said you needed to, the baby needed to latch themselves. Now for a baby that is 2 to 8 weeks old, that's kind of almost impossible. I actually trained my son to open his mouth. And I will tell you how I did it. So every time, and I had the same routine every single time. And that's another thing, ladies. So you got to kind of keep it consistent. You don't want to be trying all these different things and the baby kind of be confused as to when or how or what position they're going to be feeding in. Because after so many times, they're going to pick up really quickly on what they're actually doing. So now my son, if I lay him on the side, he already knows, he's already opening his mouth because he already knows he's about to get fed. So what me and my husband actually did together is, and he helped me, whenever I would lay him on his side, I would just gently push his lips open like so. And I would push this top lip and the bottom lip apart. And then I would also push this way. So what that did was kind of help him understand, like, you need to open your mouth in order for me to feed you, essentially. I think the worst thing is, especially if you have squishy breasts like mine, because mine aren't super like hard rock firm. There's some people's are, which it may be easier for you. You don't have to do as much maneuvering. But for a lady like myself that has squishier breasts that are softer and squishier to the touch, you don't want to be in a position where the baby latches down so hard that you have a hard time getting the nipple out of the baby's mouth. So you will have to train them. So, and it took about, I would say 8 weeks before he started opening his mouth on his own. And he realized, if I open my mouth wide enough, I will get the food, which is hilarious. I will have to actually try to video that later and show you an example, but we're just going to pretend for right now. But so now when I put him in this position, I lay him sideways, and you always want to have the head more elevated than the rest of the body. The reason for that is to prevent choking. If you have him laying like this, I know that some experts have said, this is the best, safest way. I have found that there's a higher chance of choking that way, especially if it's a particularly, a session where he's particularly more hungrier than another one. It's going to be a little bit risky to lay him flat like this. So having him propped up, even if like you adjust your knees, like I know there's those little, they're like those little stools that you can like prop your feet up on. You can buy those online. I can't remember what they're called. But they're like a little wooden stool you can set down, you can put your feet up, and it'll elevate your feet so that way you can kind of adjust. And even if you have to adjust like this, just kind of raising one leg and adjusting the other one to get him, you know, in this profile, that works as well. So once I got him in this profile, again, just to train him, I would gently touch both top and bottom lip, open it. And then if that did the trick, I'll show you what I did next. And if he didn't open wide enough, I would just simply take these two corners of his mouth and kind of spread them. And like I said, after about 8 weeks, he figured it out. So every time he lays his side like this, he opens like, ah, he already knows. It is so important that you get, he opens his mouth or your child opens their mouth as wide as possible. The reason why it's so important because you want them to latch right. If they're just opening it just a little bit, they're gonna just latch onto your nipple and you're gonna be in pain. Breastfeeding, I know they said is not painful. The first 2 weeks, let's be serious, like for real. The first 2 weeks are painful, especially if you've never fed a baby before. Regardless if they're latching right or not. You're not used to someone just gnawing at your breast 8 to 12 times a day. You're not used to that as a woman. But I promise you, after that, it minimal to no pain. I'm not gonna sit here and say like there's no pain ever. There's some times where you're in a rush, the baby latches wrong, and you're just willing to put up with it because you have somewhere to be, you know? So it's not always gonna be perfect every single time, but just try to keep practicing in order to help the baby latch right each and every time. So with that, like I said, it's so important that the baby's mouth is open wide enough for you to be able to essentially insert your nipple into their mouth. The reason why is because you don't want the nipple, you don't want them clawing down on the nipple, you want them to grasp onto the areola. So if you have soft, squishy breasts like mine, that's probably a no-brainer, essentially. But for women that have firmer breasts, it might be a little bit harder. So you may have to kind of like maneuver it in the baby's mouth. And you can always adjust a baby's positioning by gently putting in your pinky finger and loosening up that grip in order to adjust it. I do that all the time. So if they clamp down too tight, I just take 2 fingers and I'll just gently pry their mouth apart and then wiggle it around a little bit to give them the correct positioning. You can always do that. Now, if you have nails, I would say cut those nails off before you do that. You don't want to scratch the baby's gums and things like that. So back to this. So we're just pretending this is Buddy. So we're laying him down to the side and we're going to pretend as if he knows what to do. So Buddy is opening his mouth. So for me, essentially I try to cup as well as, you know, push down a little bit to make sure the leveling is correct. But with this hand, what I do is when his mouth is open, I take the back of his head gently and I lift my breasts. Again, make sure that it's center, make sure the nipple is completely center. And then I take, if his mouth is wide enough, I take his mouth and then I go, whoop, just like that. Put him right onto the breast. And so with his mouth open, he should clamp down onto the areola like so, like that. So if not, again, just take that little finger, put it in his mouth, break that hole. Make sure you cut your nails if you have sharp ones. Now another technique, which is pretty very similar. Same thing, but this time, instead of bringing his head up, especially if he's really young, like maybe, or he or she's really young, maybe 2 to 4 weeks, it might be kind of hard for you to bring their head up and latch it onto the nipple. So you may have to assist them the first couple of weeks. Now I know other videos have said, you know, essentially you want the baby to latch on, but with a 2 to 4 week-old, that's not always gonna happen. You're gonna have to assist them. So what I do is, same technique, make sure the nipple is center, make sure the areola is right where the baby's nose is, or the nipple is pointing right to the baby's nose. And eventually when they are able to see, they already know, they can see your breast. So they'll be able to sense when they're about to feed. But you're gonna take the breast, and instead of bringing the head in, you're gonna bring your boob in to the baby's mouth. So you'll essentially push the boob like so, just like this. And so when the baby has latched on and they're feeding, you can just hold them in this position. You can let the boob go, release the boob, and then you could squeeze, massage to help get some of that extra milk flow going there. can massage like so, go rub to the sides. All of that helps push that milk forward, push it out of the ducts and forward into the baby's mouth. So those are the techniques that I know that have worked best for me, especially, like I said, with a woman that has a larger bust that's, your nipples don't point straight forward. They point kind of downward. This is going to help because you will have to lift up. You will have to lift that breast up, and you will have to either insert it into the baby's mouth or bring the head forward and insert it onto your nipple. Now, women that have smaller chests, perkier breast, it's probably going to be a lot easier for you. You probably don't have to do all of what I'm doing. You probably just have to take the baby and literally just, there you go, bam, right there. But for us that have to lift up, you just know that you're going to have to do that. And always remember to use your support pillow. So if that's straining you, if lifting is straining you, if you feel like you have to hold it for whatever reason, then use the pillow to ease up on some of that stress. So that way you're not straining your arm. So use the pillow, even put a second pillow there if you need some extra cushion. That's what's going to help release that pressure in your arm and make it easier for you to hold the baby as well as hold your boob up if you feel like you need to do that for whatever reason. Now again, when you do have the nipple in the baby's mouth, make sure you're not blocking their nose. So if you have to pinch down on your nipple to kind of block the, to clear the air for the nose or clear the way for the nose to be able, for him to be, or him or her to be able to breathe, then do that. That's fine too. But yeah, that is what I do. It has been working. He is almost 4 months old. I haven't had any problems. Yeah, that's really the best tips that I can give you as far as a woman that's, larger busted. So if you ladies have any other questions, I will be posting more of these videos. If you have any questions about how to do this, or you would like to see another type of video, I have videos that I'm going to be posting soon about where I shop at for bras, as well as breastfeeding bras. And that probably will help you guys find the best bra that works for you. Because it's really hard to find bras that are really good quality for larger busted women. And it's hard to find bras in general that fit and all of that. So I will definitely be posting reviews on the best bras. I've bought them, and I can definitely give you some tips on that. But hopefully this video was helpful for you today. I'm enjoying giving all of these tips out, and hopefully it'll help a new mom. Adios. Bye.